Prescription drug plans are an important part of Medicare, but they can also be a very confusing part of Medicare. Between terms like donut hole and catastrophic coverage, it can all get really overwhelming. So today, I'm going to talk to you about the different levels of coverage involved in a prescription drug plan, and it's important to understand the differences, so stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk to you about Medicare Part D prescription drug plans. And more importantly, we're going to talk about the different stages of coverage. And there's a lot of things that go into prescription drug plans other than just choosing one. There's different levels of payment that are really important to know. So, before we get started, if you find the information in this video helpful, I would appreciate it if you give a thumbs up and subscribe, leave a comment down below. It lets YouTube know that this is important information because, like I said, not a lot of people understand the differences in these coverage levels, so it's really important to know what each one means. So like I said, we're going to talk about Medicare Part D and, more importantly, the stages of coverage. Now, if you're looking for a video on how to use the Medicare Plan Finder, I'm going to have that in a separate video, which I'm going to link down below in the description bar. So, when you enroll into Part D, there are 4 stages of coverage to know about. We have your deductible, your initial coverage, your coverage gap, also known as the donut hole, and catastrophic coverage, which I know sounds a little bit scary. So we're going to get into all 4 of these and what each of them mean. We're going to start with your deductible. A lot of people know what a deductible is. Essentially, what your deductible is what you pay first out of pocket. So with your plan, there's a deductible tied in saying you pay this out of pocket first, and then the insurance company kicks in and you end up paying copays and coinsurance. But first, your deductible is the amount that you have to pay out of pocket before insurance starts paying their amount. So with the drug plans, they're all offered by different private insurance companies, but they're all federally regulated, which means they have to follow specific guidelines set forth by Medicare. And one of those guidelines goes into the deductible. So Medicare has said that the deductible on a Part D drug plan cannot be more than $435 for the year 2020. So your deductible can be less than that. You might actually find a plan with no deductible at all, but it can't be higher than that $435. And if you find a plan that's got no deductible, that doesn't necessarily make it the best plan. It's not always the best thing to have a deductible. It may have a higher premium, may have higher copays and coinsurance. It's a lot of pay now or pay later, but you're going to end up paying. So it's really important to weigh which one is the most cost effective, even if there is a deductible tied to that plan. So once you paid off your deductible, you enter your initial coverage level, and this is where you want to be. This is the part of the drug plan that you want to stay in through the rest of the year. And we're going to talk about strategies on how you can do that. And what happens in this initial coverage level is you as a consumer still pay, but now the insurance company pays too. And your payment is different. So rather than paying all that lump sum out of pocket, you're paying in copays or coinsurances. So essentially, the insurance company pays their part and you pay your part through a copay or a coinsurance. Like I said, this is where you want to be. You want something that's going to have, a low copay coinsurance, and usually that's going to be based on the prescriptions you take and, more importantly, their tier levels. So with prescriptions, usually we have about 5 tier levels. So tier 1 is going to be your preferred generics. Tier 2 is your non-preferred generics. Tier 3 is preferred brand. Tier 4 is your non-preferred brand. And Tier 5 is your specialty medications. So as you can guess, medications in Tier 1, those preferred generics, are generally going to be the lowest copay and coinsurance you're going to see. Sometimes they're even $0. But those medications in Tier 5 usually are going to have a much higher copay or coinsurance because they're more expensive medications. So this is where it's really important to work with your doctor and see if you can get some of those drugs to be generics or be on Tier 1, Tier 2, because that's where you can save yourself some money. And that's really important with medication costs because some medications can be very, very expensive, and it's going to be really important to try to get our costs as low as we can, because if we get out of this initial coverage level, we're going to end up in the coverage gap, which is also known as the donut hole. It sounds cute, it sounds sweet, a donut, who doesn't love a donut, but this is not somewhere we want to be. You do not want to end up in the coverage gap. And I'm sorry for the cheesy jokes, but I had to throw it in there. So the way the coverage gap works is as you're paying your drug costs with your Medicare drug plan, Medicare's tracking all of this. They're tracking what you're paying, they're tracking what the insurance company pays, and they're making it into a grand total. And this is your total drug cost. So it's what you paid and what your plan has paid. And if you've got some expensive medications, that numbers can go up really, really quickly. And once you hit $4,020, you are now in the donut hole. So 2020, our donut hole starts at $4,020. And again, that's a combination of what you have paid and what the insurance company's paid. So what happens when we get into the donut hole? Now, when you're in the donut hole, your coinsurance changes. Your coinsurance will be up to 25% of both brand name prescriptions and generic prescriptions. So if, for instance, you were in a plan where your coinsurance was 10%, if you've hit the donut hole, now you're at 25%. So that can jump your cost up. If your coinsurance before was 20% and now you're at 25%, not a big jump, but it is still a jump. So like I said, donut hole is not somewhere we want to be. That being said, generally only about 12% of people make it into the donut hole. But like I said, if you've got some really expensive medications, you may see yourself getting here. And now, if we're stuck in the donut hole, the next step is to get out of the donut hole, but that's going to cost us, again, some more money to do to get out. So, to get out of the donut hole, we need to get into catastrophic coverage. That's our next level. And it doesn't really work the same as getting into the donut hole. So the donut hole, that amount, like I said, it's what you've paid and what your plan has paid makes that total. For catastrophic coverage, it's your total true out of pocket. So this is totaling the amount you've paid and then the manufacturer's 70% discount. And I know this all sounds really confusing because it is, but it's not really what your plans pay. Like I said, it's your true out of pocket. And that is the level of $6,350. And that's how we get into catastrophic coverage. So once we've hit $4,020, we're in the donut hole. And now we've got to get to $6,350 to get out of the donut hole. That being said, like I said, 12% of people make it into the donut hole. Only about 4% of people make it into catastrophic coverage. And catastrophic sounds bad, but it's actually kind of a better thing. So when you're in catastrophic coverage, your coinsurance amount, rather than being that 25%, it's going to drop down to 5%. So essentially, Medicare being like, hey, we know you've been paying a lot, so we're going to cut you a break and drop it down to 5%. So your out of pocket's going to be a lot lower. That being said, not everyone makes it to this level, and it can only be for most people last few months of the year, so you might not be able to ride it out very long. And what the goal is, it's Medicare trying to get people off of these high, expensive brand name drugs and get on more generic drugs, which makes sense, save some costs in big pharma, but a lot of people, it's really hard, especially if you've been on medications for a long time. Like I said, we really want to avoid the donut hole. That is our big takeaway message from this, is try to stay in that initial coverage because everything is annual. So if you end up in the donut hole and you get catastrophic coverage for the last 2 months of the year, come January, everything resets. Your deductible resets and you're back in the deductible stage, and you'll have to move again through initial coverage, coverage gap, catastrophic coverage. So everything resets. So that can get very expensive from year to year. So big takeaway from this is we want to make sure we can stay in the initial coverage level for as long as we can. And there's a couple ways to do that. One way is cash price at the pharmacy. So if you've got a couple medications and you go to the pharmacy and you ask them what the cash price is, and it's close to what you would be paying with your copay or coinsurance, sometimes it's a really good idea to just pay for that medication in cash. And that way it kind of stays off the record books with Medicare. Medicare is not being billed, and therefore that price is not going towards your donut hole total. So you can save money getting away from the donut hole if you just pay cash. Another strategy is using a program like GoodRx. That's a way to save some money on those prescriptions. And like I said, avoid going towards the donut hole. I know I keep saying it, but that's the goal, is stay in the initial coverage and avoid the donut hole. There's a couple other ways to save money in Medicare. Something to do is get a low price Medicare supplement plan. Gotta do my little plug. That's what I do. I assist people in finding Medicare supplement plans that meet their needs for a low cost. Give me a call. My number is 833-65-JAMIE. Visit my website, medicarebyjamie.com, or you can email me at jamie@medicarebyjamie.com. I hope you found the information in this video helpful. If you have any questions about these prescription drug plan levels, again, you can also call me. Please give this video a thumbs up and subscribe. Leave a comment down below. I left another movie quote in there for you, so if you can tell me what movie it's from, leave it in the comments. And if you stay tuned, I'm going to give you a quick tour of my website. It's going to show you all the different ways you can utilize the website, as well as all the free resources to help you on this fun Medicare journey you're venturing into. So again, thank you for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.